Morphosyntactic profile of Egyptian children after 5 years of using unilateral cochlear implants. When hearing aids are unable to give a satisfactory response, the cochlear implant is considered an important choice as it helps the children with severe to profound sensorineural hearing loss in developing language, either receptive language or expressive one. On the other hand, there is little data available on the development of morphosyntactic part of language, especially in Arabic-speaking children. The syntax is defined as the study of principles and processes of language. Syntactic categories are lexical categories or word classes are either major like noun, verb, adjective, and adverb, or minor like articles, auxiliary verb, preposition, pronoun, conjunction, and interjection. Phrasal categories are members of lexical categories combining to form larger unit like noun phrase, prepositional phrase, verb phrase, adjective phrase, and adverb phrase. Researchers have described sentence structure as a tree, with the lower branches resembling the basic structure and the upper branches resembling more complex structure. According to this research, the structure of the sentence is composed of 3 layers. The lowest layer is for verbs and their argument, second layer is for inflection, negation, auxiliaries, and the third layer is for syntactic material necessary to form questions, complement, and relatives. The aim of this study is to assess the morphosyntactic aspect of language in Egyptian children after 5 years of regular use of unilateral cochlear implant to help in designing suitable rehabilitation program. 36 children with a unilateral cochlear implant were examined. Those patients were randomly selected from outpatient clinic of Wadi Nil Hostel, Phoniatrics unit of Bani Suef University Hostel, Qasr Al Aini Hostel, which follows the same method and schedule for rehabilitation. Children were assessed from the period between March to August 2019. Complete history taking, including personal and family history, past history, developmental history, history of early childhood illness, general examination, and psychometric evaluation. Inclusion criteria: all children were implanted prelingual. The etiology of their deafness is congenital. All of them were diagnosed to have bilateral severe to profound sensorineural hearing loss. They had a trial of using hearing aid for 6 months with poor response, so they shifted to cochlear implant. All participants received unilateral cochlear implant no later than age of 5 years. During assessment, the chronological age of all the children was ranged from 6 years 7 months to 11 years 9 months. Their hearing age ranged from 5 years to 7 years and 9 months. Regular and consistent use of unilateral cochlear implant. Also, all children were regular in the same rehabilitation program and the same frequency of sessions with no periods of interruption of sessions more than 2 weeks. Exclusion criteria included chronic medical or psychological illness that interferes with regular rehabilitation, children with developmental disabilities like congenital anomalies or syndromes, and auditory neuropathy. The morphosyntactic part of real scale was applied, which included 13 training examples followed by 63 questions. All 17 features of morphosyntactic items are included in the assessment of the subtests. It includes comparatives, superlative, dual formation, negation, passive tense, derivative adjective, possessiveness, verbs with gender and plural inflection, male plural formation, female plural formation, irregular plural formation, past tense, future tense, adjective with gender and plural inflection, derivative names like jobs, connecting pronoun, demonstrative pronoun, and passive pronoun. Each child has a total raw score graded of 6-3. Also, each subtest has another raw score. Example for negation, which has 1 training example and 6 questions. So, negation raw score is graded of 6. All these questions were in native Arabic language. The total raw score of each child were scaled twice, once according to his hearing age and second to his chronological age. In real scale, a cutoff normality of a scaled score is distributed as follows. Children having a score below 7 means below average. Children having a score 7 to 13 means average. Children having a score above 13 means above average. This cross-sectional study included 36 Egyptian children using unilateral cochlear implant regularly for consecutive 5 years. This figure shows score of morphosyntactic items of real scale arranged in ascending manner from worst results to better ones. This figure shows a correlation between chronological age and the scaled score of real scale and shows negative correlation. This figure shows a correlation between hearing age and the scaled score of real scale according to hearing age, and it shows that the scaled score of real scale is not affected by increasing the hearing age. In this study, the assessment was done after 5 years of using unilateral cochlear implant, as this period is considered satisfactory for language acquisition to enable these children enter their mainstream school without marked delay. In this study, morphosyntactic profile was not affected by gender, either regarding chronological age or hearing age. This is matched with Mendes, who analyzed the role of gender on the language development in hearing impaired children and found no statistically significant difference between genders. On the other hand, Normand studied the lexical and grammatical development in male and female children and found a slight advantage of the female gender up to 36 months. The same was observed by Sandry, who analyzed the communicative profile. He found a superiority of the female gender in children between 1 and 3 years of age. Results show that the morphosyntactic score wasn't affected by hearing age. This was unexpected during this study, but it could be explained that the defect of morphosyntactic items were not related to cochlear implant device, but maybe due to the complexity of Arabic language or defect in language training, or parents were not aware of training their children on these difficult items. Egyptian children, after 5 years of regular use of unilateral cochlear implant, still have a defect in their morphosyntactic aspect of language, especially in male plural formation, past tense, adjectives with gender and plural inflection, and irregular plural formation. This is explained by most of these defects are less commonly used in mother language. Arabic language is a very difficult one, and its morphosyntactic aspect is complicated compared to other language. Like in English, the negation is much easier than Arabic. This is an Arabic root, and this table shows that small modifications on this root can change the meaning completely, like rasm, which means picture, rassam, which means painter, marsam, which means atelier, rusumat, which means pictures, rusum, which means fees, yarsim, draw, rasama, draw in the past tense, hayarsim in the future tense, and marsum is adjective. Thank you.